Tranq has already been wreaking havoc on the East Coast, and now with 4 cases in San Francisco, officials are concerned we're next.
I was just thinking it would be good to know what its characteristics are so that you could avoid it.
A powerful sedative known as Tranq has recently made its way into San Francisco's drug supply. The Department of Public Health says that xylazine, as it's officially called, was detected in 4 people who recently fatally overdosed.
The fact that it is now here and has been found in our overdose decedents, in addition to fentanyl, it is a concern that we are taking very seriously.
The drug is an animal tranquilizer that is not approved for human use. It can cause severe infections and scaly skin eruptions. It's often added to fentanyl to boost its power, often unbeknownst to users.
You're always going to have an unpredictable dose every time you use, and so you do risk overdosing, regardless of how careful you are.
Fentanyl has been devastating neighborhoods like here in the Tenderloin for the last 5 years, but the number of overdoses has been decreasing recently. Officials are concerned that Tranq may cause those numbers to go right back up again. Dr. Jeffrey Hom with the City Department of Public Health used to work in Philadelphia, where Tranq has been prevalent for some time.
It is a concern to me, seeing the significant impact that it has had, and seeing it firsthand, seeing these significant skin wounds that really were causing a degree of debilitation among people who were using drugs and injecting drugs in Philadelphia.
Most troubling is that since Tranq is not an opioid, it doesn't respond to opioid reversal medication like Narcan.
It's concerning because it does create some additional steps for overdose reversals.
Paul Harkin is head of harm reduction services with Health Right 360 and is on the front lines of the city's overdose crisis. He said Narcan still works when Tranq is mixed with other opioids.
The Narcan will still work and reverse that opioid from the opioid receptors. The xylazine is a sedative, and the person will remain sedated, so they won't come back like you often see when somebody has been Narcaned.
We're in uncharted waters here in terms of the drug supply.
Supervisor Matt Dorsey said he's working with the medical examiner's office to track how much Tranq is coming into the city.
Right now, our drug overdose crisis is the worst public health calamity we have faced since the darkest days of the AIDS crisis. But if we double that number, then we're up at AIDS levels numbers. And I don't know that there is hope on the horizon.
The city medical examiner says it has new and sophisticated ways of detecting drugs like Tranq, and they'll be monitoring the situation in the months to come. In San Francisco, Evan Cernovsky, KTVU, Fox 2 News.